All right, welcome back. Hope you all had a great week. Today we're continuing our BCBA exam practice question series. We're going through a set of BCBA practice questions, breaking them together. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. If you're looking for our proven study materials, please check out bcbastudy.com. We offer a full task list study guide, 3 practice exams, and a combo pack, which is our best deal. It does include flashcards. We also offer tutoring. Please email me for availability at the time. Congratulations to all the BCBAs who recently passed their exam. Once you pass, please let us know so we can include you in our shout outs. Otherwise, as always, work hard, study hard. Let's get to our questions. Question 1. A middle school math teacher is responsible for 25 kids in his classroom. The teacher wants to design a group intervention to target the class's ability to collaborate, work together, and reduce bullying. What procedure should the middle school teacher most likely avoid? Okay, so a couple of different things in this question. First, it's a most likely avoid question. So we're going to look for the worst answer, right? If we're going to use a group intervention or group contingency in this case, we want to find the answer that would be the worst, which is important here. Well, what do we know from the question? We know he has 25 kids. We know he wants to target the class's ability to collaborate, work together, and reduce bullying. Now, why is that important? Why is that reduce bullying important? Well, consider your group contingencies. You're independent, you're dependent, and you're interdependent. Because a contingency contract would be fine, right? Because you can make your contingency contract whatever you want, right? And you would incorporate one of these group contingencies. So we're really looking at A, B, and C. But if we want to reduce bullying, right, that implies there's an issue of bullying in the classroom. What would we want to avoid? Well, we want to avoid putting too much pressure on a single individual or a select few individuals, right? And we know there's a certain group contingency that tends to put a lot of pressure on a single individual or a certain set of individuals, also known as the hero procedure. And which one is that? Is that the independent, dependent, or interdependent? Well, it's not independent because independent says everybody is responsible for themselves. Interdependent means everybody in the group, all 25 kids, have to complete the contingency. The dependent group contingency is where we might run into problems ethically if we have bullying where one kid or a select few kids are responsible for the entire group. And when that's the case and they don't follow through or they don't meet the contingency, bullying can occur. So what is our answer? It's going to be B. If the teacher wants to use a group contingency, but reduce bullying or avoid bullying altogether, we're going to try to avoid using a dependent group contingency. The owners of the ABA clinic you work for want to create a sensory room. The owners believe that sensory integration is the key to improving maladaptive behaviors for your clients and are forcing you to incorporate sensory integration into your treatment plan. You ask your owners to explain what principles of behavior is this intervention based on. The question adheres to what dimension of ABA? Good lesson here. We don't want to bring our own biases. We don't want to bring our own experiences into the questions. Each question exists in a bubble, independent of what you know or what you've experienced. All the test cares about is your application of the behavior analytic concepts and terms that you should have studied. This is a good example of that, right? We have a sensory room. We have the owners forcing you to do this. All these issues are coming up, but what we're really asking about is the question you ask the owner, which is what principles of behavior is the intervention based on? So we really need to just ignore all this other stuff, which is serving as almost a distractor for you, and focus on the question, right? You ask your owners to explain what principles of behavior is the intervention based on. This question adheres to what dimension of ABA? Well, A, conceptually systematic, says our interventions are derived from behavior analytic principles. If you ask, hey, what intervention is a sensory room? What principle is it derived from? You're trying to adhere to being conceptually systematic, which you should absolutely do. Effective says our intervention is working and it's making meaningful change. We haven't actually implemented it yet, so we're not sure if it's effective or not. We can't say B for sure. Technological, you're not asking if you can replicate it. And then analytic, we're not talking about functional relations here. We're simply asking before the intervention begins, is this intervention behavior analytic in nature? Does it adhere to our principles? Is it derived from our principles? As a good BCBA, this is a good question to be asking for a sensory room treatment, in this case, sensory integration. So this question that you asked adheres to conceptually systematic. Your client will not pick up their toys when asked to clean up their space. You are told to use a high P request sequence. Which of the following examples best represents this intervention? What intervention are we talking about? We're talking about the high P request sequence. What do we do when we see a term? We define it in our heads. High P request sequence, the high probability request sequence, is asking a learner to engage in high probability known responses, and then following it up with a low probability response, trying to establish behavior momentum. So if you want your client to pick up their toys when asked, which of the following examples represents a high P request sequence? A, when your client picks up their toys, you provide them with praise and candy. Well, this is a consequence intervention. We're attempting to reinforce. We did not deliver any high probability request. A is out. B, if your client picks up their toys, they can play video games for 10 minutes. What intervention does this represent? The ability to engage in a preferred activity before completing a non-preferred one. This is the Premack principle, right? Grandma's law. Almost the opposite of a high P request sequence. So don't get those two confused. They're not the same thing. C, before you ask your client to pick up their toys, you ask them to clap their hands and then stomp their feet. Pretty obvious that C is our high P request sequence, right? We need them to pick up their toys. Hey, so-and-so, clap your hands, stomp your feet. All right, now pick up your toys. High P request sequence, right? Trying to build behavior momentum to get them to engage in what we want them to do. And then D, because we always read all of our answer choices. If your client doesn't pick up their toys, you take away 2 tokens. This is a negative punishment procedure, more specifically a response cost. That's what you should be able to do with even the wrong answers. Ask yourself, okay, this isn't the right answer, but what is it? Well, this is a response cost. This is Premack principle. This looks like positive reinforcement. Boom. Not only did you answer the question correctly, you now increase your fluency, maintain your skill on these other concepts. This is how you should be practicing, not drilling and killing and trying to do as many questions as possible. Use each question as a learning opportunity for 4 different answers, right? Okay, our answer here was C. Before you ask your client to pick up their toys, you ask them to clap their hands and then stomp their feet. We're trying to establish behavior momentum through a high P request sequence. For 4 weeks, you work with your client on eating soup with a spoon to prepare for a big dinner with their family. This week, they finally were able to do it independently. However, when the client arrived at the dinner, the spoon was shaped differently and was smaller, and the client could not figure out how to eat the soup. What was the problem? Some people might say, well, what's the big deal? The spoon is shaped differently, it's smaller. If you're in this field, you understand that the slightest change in stimuli can be a challenge. We made a mistake, whoever implemented this intervention, because we only trained with 1 spoon. All of a sudden, a new spoon is entered into the equation, the variable changed, can't do it. That's a problem. What has the client failed to do? Well, we know we failed to generalize, right? We have not generalized our skill outside of the learning environment. Why is it not in maintenance? Well, 1, okay, training is being conducted. And 2, it's a very specific problem, right, where we can't do it with the different stimuli, okay? We're having trouble generalizing. There's not regression, okay? We're not going to classify it as regression. It's not behavior analytic in nature. So we're looking at a lack of stimulus generalization or a lack of response generalization. Stimulus generalization says what? Well, we have a single response across multiple stimuli. We have our response is eating soup. Our stimuli is all the different spoons. Looks like stimulus generalization to me. Let's check B. Response generalization says we have multiple responses evoked by a single stimuli. Well, or stimulus. Well, we have multiple stimuli, the spoons, with 1 response. We're dealing with stimulus generalization. Once you can answer a question like this quickly, you're really starting to get a hang of it, and you're getting much closer to passing the exam, okay? I feel like stimulus generalization, response generalization, and maintenance are a really good litmus test for kind of getting over a hump, okay? Now we're past principles. We're a little more advanced. Now we can get even more advanced. If you're still struggling with these type of questions, okay, slow down, go back and review, right? Make sure you get the basics down before we get into the harder stuff. Temporal contiguity may refer to blank. Okay, kind of a fluency check. What is temporal contiguity? You just need to know this, right? It's a location of what is it? The magnitude, the effectiveness, the closeness, or the topography of a consequence. Well, don't answer topography. You should know this is not topography. It's not the magnitude, okay, because it's not how intense it is or how large or anything of that nature. It's not referring to effectiveness. It's referring to the closeness, right? When we say contiguity, we want reinforcement and consequences to happen immediately after the target behavior. The further we go between the target behavior and the consequence, the less effective it gets. And the more chance we have of reinforcing or punishing something else entirely. Temporal contiguity also refers to respondent conditioning, where we have a stimulus or a neutral stimulus in the presence of a unconditioned stimulus, and the closeness, right, starts to form associations, okay? Temporal contiguity refers to the closeness. So the closeness of a consequence, or if we're dealing with respondent behavior, the closeness of these stimuli. Contiguity, again, closeness. You and your friends always try to plan a trip over the summer together. Becky went on the first trip, but now Becky always has an excuse as to why she cannot go on the trip whenever she gets invited. This year, you did not invite Becky. The excuses most likely function as what in relation to inviting Becky? What's our behavior? Behavior question. Let's first identify the behavior we are looking at. We're looking at the behavior of inviting Becky. What do we know? We know you used to invite Becky. She went on one trip, but now she doesn't. So now you no longer invite her. Okay, what happened to the behavior? Did it increase? Did it decrease? It's decreased. So we know we're not dealing with any sort of reinforcement. We're either going to deal with punishment or extinction. Now, what stimuli are we talking about? Well, we're looking at excuses, right? That's the other behavior, but it's also the added stimuli, okay? Because who's adding it? Well, Becky. When you give the invite to Becky, what does she say? Well, the consequence of you inviting her is an excuse. So we're adding the stimuli, which is doing what to your behavior? It's decreasing your behavior. So when we add a stimuli, which decreases behavior, we're dealing with positive punishment. Why is it not negative punishment? Because we're not taking away, we're adding. Why is it not extinction? Because extinction is withholding something. Be very careful. Extinction is not punishment. Punishment is not extinction. Extinction, we will be withholding something. But since we added something, it's got to be positive. Decreased our behavior, it's going to be punishment. The excuses are functioning as positive punishment in relation to you inviting Becky. You're no longer going to invite Becky. Which of the following experimental designs requires you to withdraw the intervention? Easier question than you may think. BAB, what is that experimental design? Well, we start with our intervention B, go to baseline, go back to intervention. Are you forced to withdraw? Absolutely. B is our intervention, A is baseline. To get back to baseline, you have to withdraw the intervention. What about ABA? Well, we start on baseline, intervention, back to baseline. Well, to go from intervention to baseline, what do you need to do? Got to withdraw your intervention. And then ABCAB, we go from baseline to intervention 2, back to baseline, back to intervention 1. Well, to get from condition to condition, what do we have to do? We have to withdraw. So which of the following designs requires you to withdraw? D, all the above. Every single one of these, okay, is a type of experimental design. It's a type of withdrawal design. Okay, you got to know that, right? Don't be thrown off by the letters. Okay, you have to know this. All the above. A client urgently calls you, a BCBA, at 7 p.m. one night in a panic. They tell you that your client is headbanging. They've never seen this happen before, and usually the client is calm and compliant. What should you do first? This is a very applicable real-life question, okay? This kind of stuff happens all the time, especially if you have a difficult or larger caseload. When you get calls, frantic parents, frantic stakeholders, why is this happening? Why is this occurring? In that moment, you have to be the one who's calm. You have to know how to react. What do we know? We know client's headbanging, serious. But this has never happened before, and the client is always calm and compliant. Strange. What could have changed? Well, let's see A, conduct a functional analysis to determine the function of headbanging. Well, 7 p.m. at night has never happened before. We have no assessment. We haven't interviewed anybody. We haven't even talked to anybody. Are we just going to jump into a functional analysis? No, right? We're not going to jump ahead to headbanging. We're not going to jump ahead to a functional analysis on this headbanging. We know nothing right now. B, rule out possible medical reasons for headbanging. Yes. The first question should be, has anything changed medically? Is this a problem in the past? Migraines, ear infections, anything that might lead to this headbanging. Is this an issue? Do we know? Have you got it checked out? It's got to be your first question, because if it's medical, right, behaviorally, it's going to be a little difficult to deal with it. Okay. Once we rule out medical reasons, then we can start designing assessments and interventions. C, design a reinforcement-based intervention for an alternative behavior. We don't even know yet why it's the function, or why it's happening, or anything about it. D, implement a punishment procedure immediately to curb the headbanging. Okay, maybe, right, if it's very dangerous, but if it's medical, punishment might not be effective, and now we're just introducing aversive stimuli for no reason. So before we even do that, we have to rule out possible medical reasons for headbanging. And then finally, which of the following is not a suggested procedure when shaping behavior? Okay, straight from Cooper. What is shaping? Reinforcing approximations, successful approximations of behavior until we reach a terminal behavior. Which of the following is not a suggested procedure? A, limit the number of trials at each approximation. Now, why would you limit the number of trials at each approximation? Because if you stay on an approximation too long, you run the risk of that becoming the permanent behavior. Once they get an approximation down, we should start moving quickly to the next one, right? Remember, we're not worried about the approximations. We're trying to get to the terminal behavior. B, so A, you want to do, okay? B, proceed in gradual stages, meaning you're letting the client behavior dictate the stages you're going, right? You're gradually moving forward, again, limiting trials, okay? And proceeding in stages as we get closer to the terminal behavior. C, continue to reinforce when terminal behavior is achieved. Absolutely, it's the behavior you want to see. And how do we maintain? We have to establish reinforcement for the behavior. D, stop reinforcement when terminal behavior is achieved. You don't want to stop reinforcement, and why? Well, if you stop reinforcement, you run the risk of that behavior you just taught going away. And that would just be a disaster, right? You don't want that to happen. Which of the following is not a suggested procedure when shaping behavior? D, stop reinforcement when terminal behavior is achieved. Okay, thanks for watching. Please like and subscribe. Check out bcbastudy.com for all of our study materials. We have 3 practice exams, a 5th edition task list study guide, combo pack, comes with everything, and tutoring. Please email me for availability at this time. We will update our site shortly with tutoring hours, but right now it's going to be email only. Other than that, questions, comments, let me know. Work hard, study hard. See you soon.